While Mansi takes time to project some of those slides, which I don't need yet. As you know, I'm Vyjayanti, and I'm starting at 10:48, so I won't take more than 15 to 20 minutes, 20 minutes max. Um, COVID, COVID-19, the pandemic, as well as the stigma associated with it, we are yet grappling with the realities and the monstrosities of this pandemic more than the medical part of it. The socio-economic and the socio-legal aspects of the pandemic have uh, wreaked as much havoc as much as the medical public health part of it. It was I had no clue, as like many of us here, I had no clue what this would entail back in March 2007. Back in March 2020, until by the end of March, the pandemic and the lockdown was announced sometime, I suppose, on the 21st of March. And within a week, in less than a week, I had a spate of calls, and I don't think I'm the only such person who got a spate of calls. I had a spate of calls from working class, queer as well as transgender persons, Koti, male sex workers, MSM, as well. And in India, neither the word transgender nor the terms as lesbian, gay, bisexual, transgender aptly capture the lived realities and the amorphous identities of queer persons. There are, and there were, and are quite a few Koti queer transgender persons who were and are yet largely dependent on the traditional sources of transgender livelihoods, such as begging and sex work, and some of who were dependent on it. Now, the fact that there are many who have historically been dependent on the two to three predominant sources of transgender livelihood, such as begging, sex work, toli, badhai, seeking blessings, getting some, and being offered some dan dakshina eh, for it, is quite well known. But at the same time, there are quite a few um, ex sex workers who have somehow, with great difficulty, managed to get themselves employed in at movie theaters, shopping malls, and so on, at places, restaurants, and so on, over the last 3 years, 4 years, and more so after the Nalsa judgment, many of who lost their livelihood. And these were also the persons, these were, as I said, these are also the persons who got in touch with me. And the problem they faced was that they didn't have access to the ART. Um, those of them who were already registered at public health centers, at government hospitals, were supposed to get their ART, but in the first 1 month, there was such utter chaos, absolute chaos, that the public health centers, the primary healthcare centers, as well as government hospitals, many government hospitals had been transformed into COVID centers, the large ones, and even dermatologists, endocrinologists, who have little or nothing to do, perhaps with dermatologists who have little or nothing to do with respiratory medicine or infectious diseases, too, were sucked into COVID 19 care and response. And ART centers were working for the namesake, if at all they were working, and many of them were not staffed with persons. So even those who had to, in the first 1 month, even those who had to get their medicines were finding it difficult. And what about those who weren't registered already? As I said, there were people who weren't registered into the public healthcare system, who were drawing salaries which weren't very high, of some 15 or 14 or 15,000 or 12,000 as usherers at shopping malls, in these, what you call them, multiplexes, restaurants, and so on. And it's not difficult to understand that quite a few of them don't prefer, although their salaries are not very high, quite a few of them don't prefer to go to the public healthcare systems for the fear that half of the staff there are, apart from the government employees, are also from CBOs and NGOs. So there are these fears which could be valid, which may be part valid, or and a lot in between, that their status would be out. So many of them hadn't gotten themselves registered, and new registrations were not happening, were not being done. That's when I wrote to the relevant departments. I urged them to write, and many of them, unfortunately, were not even out to their families. They were not out to their families as queer or transgender persons, much even more that as persons dependent on begging and sex work were not out, and much, much more than that, as persons living with HIV. So they weren't willing to directly write to the governments. That's when some of us, and we wrote to the governments. We received some standard system generated response, waited for about not more than 2 weeks, and approached Jaina, and that's how the PIL got precipitated. The very first set of orders that we received was the High Court bench ordering the government of Telangana to provide for rations, food provisions, with regardless of whether or not transgender persons had ration cards or Aadhaar cards, insofar as they had any one government ID proof, that would show them as transgender. Then was this question, what about those who don't identify as transgender, who would have transitioned from male to female? And almost all of I'm not aware, I haven't met a trans brother who identifies as transgender on government ID proofs, was that question. So leeway was made. The bench and Jaina, through Jaina, the bench was considerate enough to make leeway that insofar as they have any document that shows their transition, and it doesn't have to show them as transgender, insofar as there's any document that shows their transition, they would have access to rations and medicines. It also covered provisioning of medicines for hypertension and diabetes. This was the first interim order. Thereafter, we realized by June, by the end of May, after Ramadan, across some states, the lockdown was lifted. And that was only after about a fortnight of that we realized that we were sitting under a time bomb, and COVID exploded in Telangana. Many men and women and transgender persons not excluded were being turned away from hospitals. And we've all seen this, read about it in the news. And transgender persons were no different. And that's when we had a second set of interim orders from the High Court of Telangana that transgender persons have access to transgender wards in as much as men have access to male wards and women have access to female wards. But while that order was passed, the implementation has been quite a circus. Across states for months together, COVID wards were gender neutral. And this also led across states in some or few occasions of COVID positive persons, many of them who were male, sexually assaulting COVID positive female patients. And you can imagine the plight of a transgender person if the person were to be sent to a predominantly male ward. So that order was something that our transgender communities could clutch on to, could ask for, could demand, and so on. But the system finds its own ways of subverting judgments, and in implementation, we had many challenges. Public healthcare officials, while they designated some spaces as transgender COVID wards, the frequency of healthcare professionals attending to these wards was very, very low. So again, our people were arm twisted into joining the gender binary wards. but we found ways of circumventing these structural monstrosities. Then around June, the patron in chief of the Telangana High Court, yes, can you go to the next slide? Issued a directive to the in June, issued a directive to the State Legal Services Authority to do a comprehensive study on the population, living conditions, difficulties, and challenges of transgender persons. But before we go there, just go back to the earlier slide, Mansi. Yes, this, is the baseline data of 2011 census, which shows the undivided state of Andhra Pradesh then in 2011 had a total population of 43,769 transgender persons. That was the undivided state. But Telangana, as you know, is much smaller than Andhra Pradesh. Andhra Pradesh is a bigger coastal line, has many more urban areas like Vishakhapatnam, Vijayawada, Tirupati, and now Amaravati, while Telangana has just one Hyderabad. So I don't think that the population got equally distributed to 21 and a half and 21 and a half. It should have been 15 in Telangana and the rest in Andhra Pradesh, or 20 in Telangana and the rest of the 23 and something in Andhra Pradesh. Now, the next slide. This is the comprehensive integrated household survey data, popularly known as the Samagra Kutumba survey data, undertaken in June, July, August 2014, when the newly formed state of Telangana was carved out. As per this, as of then, there were 11 states, but this was revised again in 2016 and 17 after 11 states were divided into, broken down into 31 districts. What am I saying? 31 districts. 11 districts became 31 districts. And as per this, the overall population 6.25 years ago of transgender persons was 58,920 transgender persons. Please go to the next slide. So those are the 31 districts. Now, as I said, in June, the patron-in-chief, who's the Chief Justice, gave that order. Please go to the next slide. And this led to this report from the Telangana State Legal Services Authority, and I was appalled to see that they have only covered 10 out of the 33 districts. Mind you, it's important to know that in February 2019, 2 more districts were carved out. So the overall number of districts increased from 31 to 33, with Mulugu and Narayanpet being carved out. And here in June, and this study was undertaken in June, after the 33 districts came into being, because the most recent 2 districts of Mulugu and Narayanpet were carved out in February 2019, while this study was taken up in June 2020, 1.25 years later, and it only studies 10 districts and calls it the transgender population of Telangana. I'm at my wit's end to understand this report. What about the rest of the 23 districts? And please go to the next slide. When I filed RTIs to get a clarification on this, if you can see B, one of the questions was, please share the minutes of the meetings of the consultations held with communities. जो समुदायों के साथ आपने संपर्क किया हो, సముదాయాలతో మీరు కలిసిన సమావేశాలు जो आपने संपर्क किया, उसके मीटिंग्स के मिनट्स रिपोर्ट्स दीजिए. तो वहाँ तेलंगाना स्टेट लीगल सर्विसेज अथॉरिटी ने लिखा कि no meetings were conducted to compile the data for documentation in this regard. How on earth did you concoct this data? Where did you get this data from? If we do a comparison between both, while this shows an overall population of 12 and a half something, the comprehensive integrated survey shows a 6-year-old data, mind you, of almost 59,000, 58,920, and that's 6 years old. 6 साल पुराना data है. If you look at the 2011 census held in 2011, the population was 43,000 in unified Andhra Pradesh, Telangana. Assuming the baseline to be 15 or 20, higher side 20, in 3 years, it has increased threefold. From 20, it has increased almost to 60,000. Mind you again that it does not include the population of Mulugu and Narayanpet. If you were to add that up, it will easily exceed 20,000, very comfortably exceed 20,000. So from 2011 to 2014, if it has increased 3 to 4 fold before the Nalsa judgment, before the Nalsa judgment, I don't know what the data today is. Perhaps it would have increased threefold in 6 years. If it increased threefold in 3 years, it could have increased threefold in 6 years or sixfold in 6 years. I don't know. I can't speculate. Also, what is the expertise or prowess of paralegal volunteers of district legal services to do enumeration? Typically, this exercise should have been done by the Bureau of Economics and Statistics that held the Comprehensive Integrated Household Survey. I don't know if they have the expertise and the prowess to do this. And particularly when policies are made based on such flawed, under-enumerated, under-quoted data, we end up excluding large sections of already disenfranchised, marginalized, and vulnerable populations. So, on that note, it is important, particularly when we take up quantitative data, to not exclude, to include as much, because public policy decisions on public expenditure would be made out of this. So thank you, and I call it a presentation now. Thank you very much.